Okay, here we are. So, welcome, Andrea.
Thank you for inviting me, Dr. John Beth.
This is Rekindle's very first podcast.
Yes.
And we are featuring you because you have a very interesting professional background. You are a sexologist.
Yeah.
Now, sexology is the study of sex. But in Malaysia, we're not that open to talking about sex and especially our own sexual issues.
Yes.
So, what is it like for you to be practicing sexology in Malaysia?
So, first of all, it is fun to be different in Malaysia.
It's fun to be different.
Yes, to
Okay.
be one of the few sexologists in Malaysia.
Okay.
But it is not easy to tell people this is my job, this is my career.
Yes.
Especially when I want to fill out like official documents, like to put in my occupation. They can't find a category for it.
Right.
So even if you tell them like, can you help me like put this in a category, they'll just look at me in like a weird look, like, yeah.
You mean the government officials, right?
Yeah, so it's very sad and frustrating sometimes, but that's all right. Like, I'll do.
That's part of starting a new profession. The same thing
Correct.
happened to me when I brought in marriage and family therapy into Malaysia. So
Really?
now you are also ushering a new profession.
Yeah, so I hope so. I hope I can help in putting us in a category next time.
So what else is it like to be practicing sexology in Malaysia?
I think the other issue I notice is when I do public talks, like I usually do on sexual topics, and not many people will openly ask questions or participate, unlike other topics that people usually do.
So you just hear crickets.
Yeah, like quiet,
It's just silent.
silence.
Yeah.
Even people like if you do online, they won't show their face as well.
Right,
It's
right.
like everyone just want to be anonymous, unknown.
Why do you think that is?
I think maybe people still afraid of being judged for asking question or maybe just being interested in this topic, which is very sad. I think for this century, like we are still afraid.
We're in
of this topic.
2022, but we're still afraid to talk about sex.
Right.
Right.
So it's very sad, but I guess that's where my job comes in.
Yes. Yes.
Yeah.
Wow. So, is sexology just about sexual activity, or is it more than that? I mean, what makes a sexologist different from, say, a doctor who specializes in reproductive medicine, like a gynecologist for women or a urologist for men?
So, as you mentioned just now, sexology is the study of sex, human sexuality. So, as sexologists, we are specialized in human sexuality and we hold like specific knowledge and skills. So, we study people's behaviors, their feelings, and their interaction with each other.
Okay.
And we assist them to reconcile any issue they have about their sexual experience.
So, you also include how they feel about things. It's not
Yes.
just about biology.
Yes, it's not just about biology. So our aim is basically to improve their life, their sexual life
Right.
overall.
So here is the understanding that your sexual life in your relationship is a part of your relational health overall.
Yes, correct. And how it is different from like medical doctor is that they are more focused on like the biological, the physiological side by providing intervention, more like aid function intervention. So maybe like people come and see the doctors to ask for medication for an erection or maybe hormone pill for desire. And then some people may even need surgery to reduce their sexual pain.
Right.
Yeah, so that's a bit different. But one of the things that I found and research mentioned a lot as well, they emphasize that nowadays psychological problems and culture play a huge role in sexual issue as well.
Okay.
So it's not just the medical part or your biological part, but everything else. There's many other factors that can influence your sexual issues.
Right. So as a sexologist, then you have to be aware of these non-physical issues like culture, like mindset, like attitudes,
Yes.
maybe even the upbringing in
Yes,
your family
correct.
that has shaped your attitudes to be where it is today.
Yep. So as a sexologist, we try our best to understand every aspect of the human sexuality and to understand the issue in a more holistic way.
Great. So, how did you ended up in this field? Tell us about your educational pathway and how you ended up here.
So long story short, I was born and raised in Sarawak, and
Where
I
in
come,
Sarawak?
yes,
Where?
in Miri.
In Miri.
Yes,
Okay.
Miri. And I come from a conservative family. I think most of us, a lot of us are coming from that. And we don't talk about this kind of sensitive topic like sex, relationship, even negative emotion as well. But I was a very sexually active, curious girl.
Ah,
Yes.
and you're not ashamed to admit it.
Yes, there's
Wow.
nothing wrong to admit this.
Wow. Okay.
And I remember searching for information about sex, relationship from like magazines or like, like newspapers. Sometimes they have some articles about it or movies and love novel. Like that is the few resources I have at the
Right.
time.
Right.
And I also noticed a lot of things happening in school, like sexual harassments among students and even teenage pregnancy among my friends.
Okay.
And I feel very sad to see them drop out of school because they
Right.
got pregnant.
Right.
And there's a
Right.
lot of stigma around them
Okay.
after that.
Mhm.
So it's very hard to see that. And no one did anything about it
Right.
to change this. Like the school didn't do any education or no awareness about it to prevent this happening, to continue happening in a school and to
Yeah.
make school a safe place.
Yeah. Now, listening to your story and why you got into this field, now I'm starting to feel quite moved.
Yes.
Especially thinking of a lot of lack of education that leads teenagers who are naturally sexually curious, to do what they do, but then they have huge consequences.
Yes, and it's because one of the reason there is lack of education. Like they didn't have information of what will happen if they did this kind of behavior. And mind you, my school was kind of like a lot of the students are from rural area.
Okay.
So there's a lot of lack of parenting and lack of education as
Right,
well. So
right.
no one guide them basically.
Right. Is there anything else besides that led you into becoming a sexologist?
There is, I think, fast forward to my undergraduate, I was studying psychology, and I found out that you can actually specialize in certain field like sexuality. So that is when I was like putting that as my goal that I want to be specialized in that. I didn't know how yet
Okay.
during that time,
Right.
but I was like, that's where I want to be. I want to be specialized in sex. And when I was searching for a master course in Australia, as usual, people usually recommend like counseling, clinical psychologists, right? Then I found that Curtin, Australia, actually offer this course called Master of Sexology.
Okay.
So that's where I got interested in it, and I was like reading the outline, do some research about it, and then I applied it and I got in.
Great. Where's Curtin again?
It's in Perth, so it's in the
Okay.
Western Australia side.
Okay.
And I was the only Asian international student in my batch at that time.
Wow. And what year was that?
That was like 2016.
2016. Wow.
Yeah. There are other Asian students, but they were like already local, as in like Australia.
I
But
see.
I was the only Asian that is like international student.
Right. Right. And what was your experience like being exposed to a Western way of dealing with sex?
So that's a good question because when I was there, I did a lot of like volunteering job, especially with the Western Australia AIDS Council. And it was interesting. It was an eye-opening because we went to like different towns, different university, public events, and we opened like booth and like talks to educate or to promote sex education and safe sex. And it's something that I wish that I can do more of that in Malaysia because it's very informative and people are actually interested to learn more about it, and they will participate in activities, games, and things like that. And we even give out free condoms.
Right. So generally speaking, in the Western context, people are much more open to put in the effort and the energy to educate the public.
Yes.
And I'm guessing what you're saying is a lot less here in Malaysia. Is that right?
Yes, a lot less, and it's a bit more secret.
Like stigmatized or secret?
It's secret, like as in like not meant. It's not publicly
Announced.
Yes,
Right.
that there is this kind of event that is about sex and things like that. It's
Right.
very like localized or like
Word of mouth.
word of mouth,
Right.
basically. Yeah, compared to in
So
the
if you're
Western.
having an event here, it would be something that is quite a bit more private. You know, you
Yes.
whisper, and then the
Yes.
people come.
Correct. You
You
just
won't-
share with your networks and
Right.
things like
So what
that.
we're doing here is a little bit different. Just openly talking about sex
Yeah.
and sexology.
Yes,
for
I
now.
think that's the most that a lot of people try to do in Malaysia is to talk about it. Like we do live IG talks, we do FB live to talk about it, because at least people from all over the place can listen to it.
Maybe that's what we need to do next after this.
Maybe.
Yeah. Okay. So you have been practicing sexology for how long? Postgraduate?
Around 4 years.
Around 4 years.
Yeah.
So what has been your best and your worst experience so far?
I think the best experience would be seeing my client's face that they can finally enjoy sex like they want to.
So I'm just curious, what does that face look like?
Well, usually it's like happy face, grateful, and satisfaction. Like when they come back and tell you that, oh, we finally able to feel relaxed and enjoy it. Like it's so different than last time. It's so rewarding to hear that from them, to see
Right.
them.
I like the word relaxed, right? It's almost like this is like natural,
Yeah.
right?
Yes.
This is so natural and enjoyable.
And that is like for me it's like I feel it's like there's this I imagine it's like I'm teaching them, like teaching a kid
Right.
riding a bike,
Right.
right? And then we will ensure they are ready first. We make sure that they know how to keep themselves and people around them safe, and we teach them like skills, how to ride it properly, how to take care of their bike, and eventually they will be able to ride it by themselves after few practice of ups and downs. And we trust that they know how to take care of themselves and their bike after that. So that's how I feel like when I help my clients. I feel like I can finally let them go and they are able to do it by themselves.
That's great. So what about the worst experience you've had?
So I think the worst experience that I can think of would be people who only want fast solution in overcoming their sexual issue. So they don't feel like they need me. They don't feel like they want to see a sexology who can't prescribe medical solution. for
I
them.
see. They want a pill, pop me the pill,
Yep.
and then my problem should be solved.
Yes, correct.
see.
Which is very sad because sex is a whole experience. It's not just like a medical solution that you can take a pill and you're fixed in that sense.
Right.
Like you need both your psychological and your physical side to be ready, to be able to go for it, to have that sexual experience as a
Right.
couple together.
Right, right. Some people are impatient or for whatever reasons,
Yeah.
they feel like, oh, I don't want to take, I don't know, a few months to learn how to drive a car properly, right?
Yes,
Just
correct.
download and then I can just do it.
Yeah, something
Right.
like that.
Yeah.
Yeah, they want fast solution. Like, can you just give me a pill or any fast thing? Like the next few days I'm done. This kind of
So
thing.
when you encounter a patient or a client like that, what's your typical response to them?
So usually I will advise them like the pros and cons. Like yes, if you want medication, these are some of the benefit and these are some of the consequences that may happen. And what's the benefit of coming for sexology session? So I will explain that and let them choose and decide what
Okay.
they think is best for
Right,
them and
right.
their budget as well.
Right. So we need to hear what are some of the benefits of coming to see a sexologist.
So I think some of the benefit that from what I hear from my client is that they feel that they can finally see sex as something to do with their partner, not a chore, not a task that I need to complete because I'm a girlfriend, I'm a wife, I'm a boyfriend or husband.
I'm
things like
already
that.
thinking of who can come and see you. Can you guess who it is? We won't mention any names at
Yes.
this point, but that's okay.
Yeah, so that's one of the benefit, like they can feel relaxed and sex is something they can enjoy with their partner. The other things that they learn is what things that their sexual need or their partner's sexual need that they never know, like they never talk about it, like
Right.
yeah, so like they never know that, oh, my partner actually like this kind of touch, that kind of sensation. So in the session we talk about that.
I imagine some people don't even know what they themselves like
Yes,
and dislike.
correct. Yeah.
Well, maybe they know what they dislike, but they don't know how else it could be different and
yeah.
enjoyable. Like you said, relaxed, natural enjoyment.
Yes, like a lot of the clients that I seen last time, they don't even know what is orgasm. They don't even know that that they can allow themselves to enjoy this kind of feeling, which is very sad because that is the fun part of
Right.
having sex with your partner.
Right.
But they don't know that they have that right to do that actually.
So there are a lot of benefits, and we don't know what we don't know until we start to hear some stories.
Yes, correct. That is true.
And I'm sure you have a lot of stories to tell, but maybe we'll reserve that for another podcast.
Yes, could be. Yeah.
So I'm curious, you're now finishing up, actually you've already completed all of your requirements in your Master of Professional Counseling, right?
Yes, correct.
So why did you choose to add on another master's degree to your Master of Sexology?
So this is quite interesting because, to be honest, counseling was not in my list. But being in the sexology field actually changed me. Like, I saw so many couples who were suffering in their sexual and also relationship. And a lot of the time it goes hand in hand, the issues, and I was stuck. Like I didn't know how to help them when they are also having relationship issue. And I noticed that when our relationship is affected, we wouldn't want to have sex with our partner. We wouldn't want to be intimate with our partner
Yes.
as well. And it's very hard to just fix the sexual part if the relationship is one of the main contributor to the issue as well.
Right.
Because there's like there's so many type of emotion will arise, like
Right.
anger, anxiety, resentment, even trust issue. So it's like how do you want to have intimacy with your partner if you have all of this keep inside you, right? So that is what made me decided to take counseling, because
So sexology, even though you did cover, feelings and attitudes and mindsets about sex, it was not enough.
yeah, it was not enough in terms of the therapy part, in terms
Yes.
of handling a more deeper part of the issue. I
Yes,
feel.
yes. So the counseling then gives you the ability to handle couples' issues going deeper into their emotional needs, maybe even trauma.
Yes,
Yeah.
yes, it could.
Trauma, ongoing dysfunctional couple dynamics, things like that.
Yes, like many of that. So that's where when I was learning counseling, I noticed that there's a lot of skills. There's a lot of skills that I can learn and apply it inside my sexology field. And it helped me. It helped me more confident. It helped me to improve my therapy skills. And I feel that it's a more holistic way to help my clients, especially couples. And it lasts longer actually, because
Right.
you deal with not just the sexual part, but everything else that may influence that.
Right.
Yeah.
Wow. So at this time, you are a senior clinical intern at Rekindle, and that means you are en route to becoming an associate therapist once you get your Lembaga's counseling license.
Yeah.
Right? So I'm curious, with this dual specialty the overlapping specialty. How do you see yourself continuing to grow in your expertise?
So it has been an interesting journey, and I learned a lot of new skills, and it made me realize that there is more to just sexual health. So we can actually include many other things in our life that can help you improve your sexual life. So I will think it as a way that I will be, as a sexologist, it provides me the foundation to be comfortable with this topic when I'm talking it with my clients, and to be able to open this topic with my clients when needed, and to be able to provide a safe space for my clients when they do not have anyone else to talk about it, so they can explore and talk about this part of them in session with me. So it's more like maybe a counselor who is like major in sexual topic.
Right.
Yes.
In the field of marriage and family therapy and counseling, we have the sex therapist. Is that something that you see yourself moving towards?
Yeah, I think so. Yes. So that, as I'm always interested in the sex part, in the sex topic, and that is my goal. In terms of, even when I become a counselor, it's my goal to be focused and specialized in that area. So sex therapy would be the way to go.
Right. And I imagine that because sex is related to so many other things, a lot of people now struggle with infertility.
Yes.
And having sex during that process, the IVF process, can become quite challenging.
Yes, even just talking about going through IVF is also very challenging for women, especially because I do have a client who was struggling to just accept that she needs IVF, that she can't conceive naturally, and that is also an issue that we can talk about in counseling in
Yes.
this.
Recently, you have picked up training in EMDR,
Yes.
eye movement desensitization and reprocessing, which is a scientifically proven effective treatment model for handling trauma.
Yeah.
What are some of your emerging thoughts about that work, that particular training in helping couples or individuals with regards to their sexual issues and questions?
Yeah, so I feel that it's very interesting how EMDR can actually help clients to process their trauma or any adverse life event quickly, and when they're able to process that, it will actually help them to move on faster, and they can learn the skills faster as well, because they are able to deal with the past easily now, and they can focus on the present, on how to improve their current life, their current sexual life better.
Right. So the EMDR can help to remove some of the traumatic emotional blockages.
Yes.
Like if someone was molested, they may be very sort of frozen,
Yep,
during intimacy.
Yes.
But with EMDR, you can sort of clear that off. But then they still need to learn
Yes.
how to open up and be
Yes,
natural.
the skill is still missing there.
That's
in
right.
that sense.
Right.
So that's where, when they are able to deal with the trauma, then at least they are more present to learn the new skills that can help them to be better or
Yeah.
improve their current life.
Yeah, that's fantastic.